After heart disease and diabetes, cancer is also emerging in India as a leading cause of illness and death. Among men, the incidence of prostate cancer is very high, followed by the lung cancer. In women, breast cancer is the highest. Recently, in some regions, mouth cancer is also raging due to the habit of chewing tobacco and pan masala. Cancer should be called a symptom rather than disease. It indicates the abnormal, uncontrolled, and rapid growth of cells. Because of this, cancer cells are malignant in nature. Cancer cells differ from normal biological cells. Firstly, so long as the host is alive, cancer cells are alive and rapidly multiply themselves to form new cancer cells. They do not die until the host dies. But in case of the ordinary cells, they after a cycle decay automatically. Secondly, cancer cells can undergo metastasis. The term metastasis means transfer of cancer cells from one organ of the body to another, not directly connected with it. All malignant cells are capable of metastasizing, which means forming new loci in a distant part of the body from the original position. Ordinary cells, on the other hand, have no such power of metastasis. There are more than 100 types of cancer, but broadly speaking, they are of two types. First one is carcinoma, meaning malignant new growth made up of epithelial cells tending to infiltrate surrounding tissues and give rise to metastasis. And the second one is sarcoma, means cancer arising in bone, connective tissue or muscle. There are three methods for treating cancer: surgery, radiation therapy, chemotherapy. There is of course another way of treatment, the immunotherapy, the manipulation of immune response which is still in its infancy. Immunotherapy is often tried in association with chemotherapy. In chemotherapy, the main basic factor in inhibition and cure of cancer lies in the ability of drugs or chemotherapeutic agents to kill cancer cell. These drugs have, however, no capacity of repairing or converting a cancer cell to a normal one. Cancer risk increases with age. The older people get, the more likely they are to get cancer. The reason may be that the body's immune system, which enables it to fight many threats, shows a decline with age. One more reason may be that cancer virus lying dormant for many years flares up. Tobacco, which is known to be weakly cancer producing, shows its effect after a long period of time. The slowness of the development of the disease may be the chief reason for the apparent link between aging and cancer. Cancer of the prostate also comes on fairly late in life. Hence, it has been nicknamed the old man's cancer. Body shows some symptoms. They are any sore that does not heal, a lump or thickening in breast or elsewhere, unusual bleeding or discharge, any change in a wart or mole, persistent indigestion or difficulty in swallowing, persistent hoarseness or cough, any change in normal bowel habits. The role of cancer medicines is undoubtedly remarkable owing to the increasing scope and complexity of cytotoxic drugs. In this connection, a large number of plants have been tried and quite a good number of them have been used with success. Some of them are sadabahar plant. Its roots and leaves are used in the medicinal purpose because of its properties: stomachic, hypoglycemic, sedative and anti-cancerous. The plant is found to be powerful anti-cancerous, yielding two important alkaloids, vincristine and vinblastine. They are powerful cytotoxic agents which arrest dividing cells in cancer. They are being used to treat the Hodgkin's and non-Hodgkin's lymphomas, leukemia, breast cancer, and other related problems. It is also used as hypoglycemic agent, and also as it is sedative in nature, it is often used in stomachache. The second one plant is Sharifa, sitaphal or custard apple. Its leaves, bark, roots, seeds and fruit are used for medicinal purpose due to its properties: astringent, tonic, antihelmintic, purgative, diuretic and anticancerous. It is found to have anticancerous properties against human epidermal carcinoma of the nasopharynx in tissue culture. Ripe fruit bruised and mixed with salt is applied to malignant tumors to hasten the suppuration yani pus formation and healing.